Assalamu alaikum, the communication day. First scenario, you are the doctor in the ward. Mrs. Smith, 55 years old lady, has smoked for most of her life. She is widowed and lives alone. She has recently become increasingly frail. She was admitted with a suspected chest infection, but has had a chest X-ray that highly suggestive of lung cancer in the peripheral lung field. She needs investigation to determine further management as per the consultant plan for today. You have been told by the nursing staff that her son, Mr. Turner Smith, has said that he doesn't want his mother to know about the diagnosis. He has also said that he doesn't want his mother to have any more investigation or treatment, but to be kept comfortable. Please discuss and address the concern with the relatives. Concern. Mr. Turner Smith, the son. Okay, Dr. Sarah ready?
Yes.
Here you go.
Good day. I am Dr. Al-Ahmadi, the doctor in the service today. May I confirm that you are Mr. Turner, son of the Miss Smith?
Yeah.
We are here together to discuss your mother condition. May I ask if you are next of the kin?
Yes.
And it's come to my knowledge that you are take permission from your mother to talk about her condition.
Yes.
So to be in the same page, can you tell me more about how much do you know about your mother condition?
Well, I've asked to speak to a doctor actually about because I'm concerned a bit about what I've heard today. I know that the team is suspecting cancer, and because of, to be honest, I don't want her to go through this stress of investigations, side effect of treatments. This is why I wanted to talk with you about, doctor, to be honest.
Thank you for sharing this with me, and I appreciate that you are caring for your mother. May I know why you don't want her to going through this investigation?
Well, thanks for caring, doctor, but I guess we saw our father, my father, suffering from that journey, and he eventually died. He suffered from the catch up with it, and then the side effect of the treatment of the chemo. I'm sure you know better than me about that, and eventually didn't help at all.
I'm sorry for what you are going through, and please accept my condolences, and I'm sorry for your loss. If you want, I can explain to you more about your mother condition.
Yeah.
Okay, so your mother admitted to the hospital because of sensitivity of the chest bugs. And when we do the scan, we found there is suspected mass, the cancer in her lungs. And after discussion with our senior, he advised to do a more investigation. As you told me that you passed through what your father passed through, but not all the cases is the same. Sometimes it's different from person to person. So your mother is competent and she can understand and she can choose what she wants if she wants to do this investigation. This type of um, type of investigation that to know what's the type of the cancer that she have, and after that we will give her the proper management plan. So what's this sound with you?
Well, to be honest, I do prefer if she's not to be informed about it, not to worry about it, to be honest.
I'm sorry for that. Can you know? Okay, I know why you don't want her to know about it.
Because the reason that I've told you, doctor.
Yeah. So if she has a right to know about her condition and to decide because she is now aware and she has a right to choose what she wants. And I want to reassure you that we are professional in breaking bad news, and we will give her with the support um, to inform her about her condition. How
Hmm.
this sound with you?
What would be the benefit for her to know, to be honest? Um, can't I take this burden instead of her?
Uh, I appreciate your concern. Can I ask you if she has any wishes if she has this condition?
Wishes in terms of?
Yeah, if she talk before with you or discuss with you what she wants, if if she is sick, what she wants or what the plan she wanted to do it in her
Uh,
condition.
we had this conversation and because of some circumstance that happened, and she does have an advance directive, yes,
Mm-hmm. Okay. But at this time
of DNA
also.
CPR, advance directive of DNA CPR.
Okay, okay. I appreciate your sharing. Thank you for sharing this with me. But as I discussed with you, she has a right to know about her condition. Also, she has a right to decide if she wants to take the treatment or no, or to do this advanced workup to know about her condition. May she agree or disagree about it? So I'm sorry to tell you that we cannot hide this problem from her.
Hmm. So
Do you have
okay,
any question or concern at this time?
so taking this forward, do you know what sort of options do we have?
Yes. At this time, we can do an advanced scan for her, and also to take or take a snip for her from her lungs. We will discuss this with her about what we will choose the best for her to do it. And we will send this snip to laboratory to analyze it. After that, we will decide what's the next plan if she will take a medication that's called chemotherapy that's kill the cancer, or we can do the surgery according to the type what's the cancer.
Okay, so do you think that she does have chance?
I highly appreciate your concern. It's early to say now. After we did this scan and step, we can decide at which level she has this disease.
Yeah, but to be honest, yeah, I appreciate what you've said. So you think that she should be uh, involved?
Yes.
Okay, and other than this, what sort of um, can I attend this? Can I be there with her when you wanted to discuss what's going to happen?
Yes, of course, you can attend with us if she allowed. We can discuss with her and choose what's the best for her also.
Two
You
minutes
can
left.
attend if she wants. And be sure that we will give her the best management plan and we will support her.
Okay.
May I ask you if she is living with you or alone?
She's living by herself.
And she is financially support or she need any help?
I don't know, to be honest, after this admission, if she would need any help or not. This was my worry. If in case if she didn't want to go through the investigations, what sort of steps that will take place.
I appreciate your concern. If she don't want to go through all this, we have another option. It's called supportive treatment or comfort treatment. It's called palliative treatment. We will discuss also this another meeting. We will support her socially and financially and also emotionally if she wants. Um, we will discuss this in another meeting, this option, if you want.
Yeah. So is there any form of support you that this will be there if she even didn't want to go through the investigations?
Yes, we will give her the support and another type of caring to keep her in the
Mhm.
comfort zone without any pain, without any difficulty. So she will live in the
Thank
her
you. Yeah. Thank you.
Time is up. Perfect, Dr. Sarah. Dr. Omar, you can comment now.
Thank you, Dr. Sarah. Very perfect, mashallah. Well, you've repeated the comment first, before I forgot. You've repeated yourself again by asking him why um,
mm,
you don't want to. This would give the one who the assessors that you weren't listening to what he just said. Did you get my point?
yes. I think
Uh,
he said that they want you, the son, don't want her to know because he passed through a hard time, not his mother. So because of that, I repeat the question. Okay, yeah, I get it now.
Yeah, but yeah, so if you okay, so it would be the same reason likely. You can is it because of you can use the alternative like is it because of the same reason you just told me or is there anything else going on in your mind? I would say no,
Mm,
it's the same. So this would be instead of repeating the same phrase again, can I know why? This would sound robotic or would
mm,
sound that you didn't listen. And the one who examines, he would be examining five candidates at least. So he will be hearing the same things like imagine yourself hearing the same thing every 5 minutes, every 10 minutes.
mm,
So he might not be focusing. So, and these kind of questions might imply this. You didn't need to go through the condition. He just started the conversation with what he has heard, and he was asking, he started the conversation with a concern. So, don't hide behind the bushes. Just, I know that you wanted to grasp the thread of the conversation again by starting it in your way, saying, okay, this is the cancer and what we are going to do, but this is not what the surrogate wants. The surrogate basically does have a concern, and his main concern, can I take this? You should you should have appreciated more his uh, caring because he's not doing it because of like he you don't have any safeguarding concern on him. He just basically sincere in his feeling and he doesn't want his mom to suffer. You know what I mean? So
yes,
empathizing with that, but at the same time use this as an excuse to tell, but we need to in order for your mom um to take to know her options, she needs to be informed. And potentially, if we did the investigation, use the benefit of the doubt because it's not written clearly whether it's an early stage or late stage. So
mm,
you can say, if we didn't do the investigation, we might miss a treatment window, which this can be potentially curable. And if it is curable, then she is going to restore her life, her life without worrying about anything, about going through extensive treatments. So it will be managed surgically. And
mm,
if not, And if she doesn't, you should be using also the same, supporting her, showing solidarity by, okay, we understand what you are saying is because you are caring for your mom, but we at the same time have obligations to go for to inform the patient and to act on the patient best interest, by saying when we give her the options, he would say, can I be there? Yes, of course. So the options would include everything. But in order to know what options, we need her to have these investigations, um, which would allow us to have all options. One of them that it could be full curability, the others it could be medications. She, of course, we will support your mom's decision, whatever it is. If she does want, we have to support it. If she doesn't want, we will continue to support it.
Mm.
Okay. Um, the other thing is that I've written the opening. You could have used uh, better opening. You are in a ward, so you are going
Mm.
to the patient bedside, um, asking him to come to a private place where you can have this conversation. So yes, you will confirm it in that way, but um, tell him that I do understand that you are here to discuss because I've been informed that you do have some concern regarding your mom's care. I'm here to help. Can you please let me know what's worrying you? He will start to talk. It would sound a little bit more better than the standard way if you are meeting a patient in a clinic, he's coming to you, you are not going to him. Did you understand my point?
Yes.
Um, have you didn't check that his mother is competent or not? There is four C's we've talked about. I don't know if you've heard. Have you been into the last week discussions or the last few weeks discussions about the talking to relative?
No.
So there is a four C's: consent, capacity, concern, and coping. You've touched with the consent, with the concerns you are managing, with the coping, you've asked how she's coping at home. But the capacity, you don't ask her, does she have capacity? Ask the surrogate, but you can touch on it in a very clever way by saying, okay, have you been into your mom's bedside today? How does she sound to you? Is she once because if he's telling you that I want to, can we just not let her know? So it could be because he's caring, or it could be because if his mom doesn't lacks capacity and you established earlier in the conversation that
Mm.
he's the next of kin, then he's now in a position that you need to um, talk more about the benefits and to give him the risks and benefits of everything because he will decide if his mom is not if his mom doesn't have capacity. And if he's refusing, then it would be a different scenario by involving a senior member of the team who would act on the best interest of the patient if we think that the relative is not acting on the best interest of the patient. But it would sound good if you will touch on the capacity indirectly. How did she sound to you? Is she in pain? He will tell you, yes, she's good. If he didn't raise any capacity problem, then it's fine. Did you
So
get my point?
it's not enough to say you take permission from, it's come to my knowledge that you take permission from your mother.
Yes, but permission is establishing the consent. I assume that your mom is happy
Uh,
for
okay.
us for you to speak with us about her
So
case.
this different,
Yeah,
different
so
question. Yeah, okay.
consent is different than checking the mom's
Mm,
capacity. Mom's
okay.
capacity is her capacity to understand, withhold, and digest and return back the information that's being given for her. If this is the capacity, you didn't see the patient. There's nothing mentioned in the scenario about it. It's better to
Mm,
ask about it. They do like that.
mm,
He checked the
okay.
capacity. He checked the consent. He checked the coping. So those are four C's in when you are speaking, whenever you are speaking with a relative, check the four C's in your mind, you know? Um, uh, you are not obliged to check the capacity with every time. For example, if the surrogate wants to talk with you about the diagnosis, this is his concern. What is the cancer? What is this Huntington, or what is this MND? He's not talking about decision, or doesn't want to withhold information, you know? So checking capacity is not vital. But in this scenario, to be honest, checking capacity, it would, for the sake of completion, okay?
Mm,
Because from the stress of the exam, you would might miss something. You might be, saying a phrase twice, which you don't know how stressful you will be. I'm not saying you're going to be stressed, but it's better to keep these things in mind. Capacity, they like it. They will type in as it happened with my case. Even though that I he said, because I used the same word. Have you been to your mom's bedside? Did she sound coherent to you, or did he said yes? So they said checked capacity in
mm,
in a, in a good comment. You know what I mean? So they will pay attention if you are checking the capacity, your opening, because if your opening was solid, they they will like reluctantly listening. You know what I mean?
yes.
But you did so well. There is no major problems. There is no textbook for how you are going to go through the station. It's unlike like the examination or the long consultation station, where there's the structure is not. You need to apply it on the situation you will find yourself in. Did you get my point?
Yes, doctor, thank you.
What else? Uh, you've used a very good word about her advanced care wishes, which is very, very brilliant of you. Bravo, Yani. Um, it
Okay, thank you,
very,
Dr.
very
Omar.
well. Yeah.
Yeah. Yeah, I
For
think,
the
yeah.
four domains, yeah. Okay, yeah.
Continue. Do you want to
No,
add
no,
more?
no. No, no. I don't know the four domains. So for the clinical communication is full mark. Clinical judgment, yes. She managed the concerns. Um, uh, no particular consent that was dismissed, to be honest. Um, welfare is maintained. Mike is with you, Dr. Bassett.
Okay. Thank you, Dr. Omar. Dr. Sarah, please, before I start comment, try to share the scenario, please, for Dr. Omar in order to start immediately after my comment. So I will comment in two parts in the clinical communication as well as the clinical judgment. I agree with Dr. Omar comment somehow, but I will explain more about the capacity, how you can do it in a simple way. Okay, from the start as introduction. How are you, Mr. Turner, and how your mom is doing now? Maybe by this question you check the capacity. He'll tell you, yes, doctor, I can see she is feeling stressed, she's feeling difficult to breathe, whatever he will mention. But he can add to your knowledge if his mother had the capacity or no. He will tell you, no, doctor,
Mm-hmm.
I can notice that she's confused somehow nowadays. Whatever he will mention, but what I want you to do it in a classic way. How are you? Uh, can you tell me about your mom condition in this way? Or how is your mother now? How is she doing now? Whatever. So it's you will cover the part of capacity. And as again, it's a classical way to start any scenario by asking how is your condition or how do you feel or how are you or how about your knowledge? What do you know about your condition? What do you know about your mother condition? Whatever the way, But you
Mm,
will grasp this information from him by asking this question. The next part will be on the advanced directive. Whenever he told you, doctor, she discussed with me about my father and doesn't want to be managed in this way or that way, you can respect, first of all, appreciate sharing this and respect the wishes. And you can tell him, yes, we will sit with your mom discussing this point with her and we will respect it. Totally agree about that. Okay, because anytime, at any time, even she has or she doesn't have cancer, the best way is not to be more advanced and aggressive in her management because she is frail, living alone, had
mm,
cancer. I don't know if it will be metastatized or not. So you can say we will respect that and we will update this in records after confirming this information from here because you are not sitting with her now. You have to sit with her and to confirm it. The next comment about financial. Don't you think a frail woman sitting alone or living alone need financial support? The most important to cover is
for sure.
other support, not financial. Okay, all by default, all people there in UK are financially supported, even in our countries. So they have the way they can as a financial, but the need usually will be other support,
Mm,
social or psychological,
emotion.
emotional, all the things, health, some medication, some occupational. Okay, so don't offer financially whenever you want. Does she need any kind of support? The last comment regarding does she live with you? They like the examiner. They like and they love when they feel that you read your scenario well. It's not written there. It was written that she lives alone. She is widowed and lives alone. So you can tell if you want to start. I can see in the note that your mother living alone. Do you think does she need any kind of support? In this way, you will pay attention to the examiner that you are reading properly, you are focusing in your reading. At the same time, you offer the support. Okay, try not to ask things.
Something like that.
Don't ask
Mm,
things which is already mentioned in the scenario.
mm,
Instead, you can confirm it. So you can do it in an challenging and as a questioning, not as a questioning, as a weapon to use it in another question. Okay, so I can see in her note that she is living alone. Does she need any kind of support in this way? Or if there is a job, for example, there is job in this scenario. I can see from your note that you are working as driver. What do you think the impact of this disease on your job in this way? Don't go like I'm asking only question and it's already written in the scenario. Written in the scenario, he's driver. Why you are asking him, can I know what's your job? Means that you are not focusing in your reading. Okay.
mm,
And this one or this task will give very nice impression to the examiner that you are perfect in the practice. Okay. So the
mm,
way to read, focus, and use it in the discussion that I am showing the examiner, I read my comment well. The cancer you mentioned, you can say there is some shadow in the X-ray suspecting a cancer or highly suggestive of a cancer. And we have to do further investigation, scans, imaging to confirm it. And again, as Dr. Omar said, if he mentioned it, don't repeat the question. May I know why? He told you already that I don't want to go through one, two, three. So you can, if you want to repeat, yeah. So as you said to me, you don't want her to go through these steps, but I like the answer when you told him we have professional team they can break the bad news properly without hurting her. This is the way how to answer any autonomy point if the patient or the relative doesn't want the father or mother to know about the information or the disease. So you can use this way. We have perfect team. They can break the bad news gently without hurting the patient. Okay. Well done, Dr. Sarah. By the way, I give you 12 out of 16, but you deserve 16 full mark Why I give you the 12? Because I want you to be motivated, not to be feeling like I'm satisfied with my effort. I don't want to do anything else. I know that your exam is soon, but really you are doing perfect job. You can get the full mark easily. You know how to communicate, but just the few comments I add, use it, and you believe me, you will gain the full mark.
One more thing, Dr. Bassem,
Thank you, doctor.
regarding the advanced directive you've mentioned, which is a very good point that you raised. So the advanced directive, I quote her and then let her know that what we signed is the DNA CPR, because if if the cancer is treatable, then it is a reversible condition, which can be, even though if there is an advanced directive that she is frail and she uh, doesn't have she if she deteriorates, but in this scenario she's not deteriorating, so the advanced directive doesn't have that much implication, but it is a very good thing to be covered in the scenario that the patient does have treatment escalation plan already. Why I want to clarify this, because sometime it might imply that you don't understand the advanced directive if you didn't um, uh, ascertain that the wishes, did she wish anything specifically in her plan? Did she mention anything with related to the cancer? He would say no, or I don't know. So we have to go through her plan or her wishes again, and it will be mentioned. If it is, it will be mentioned in the stem. So it is a very good point that you've reminded us. Dr. Ala also mentioned that one concern is dismissed, which is what when I asked what's the benefit of telling her if there is no hope. Um, I remember that she replied back
Yeah,
to this, but
let's
not
ask her
necessarily. Yeah.
again. Yeah, let's ask her again what she will answer if the question came to you again, Dr. Sarah. What do you think
Um,
the best answer
yeah,
or
yeah, your concern is valid. Uh, it can be it can be in early stage, so we can treat her early, and she can live after that normally.
yeah, but again the decision will be belong to the patient. So
Yeah.
it doesn't matter is it early or late. This is her decision to be shared from the start. From the
Mm.
start and beginning of the journey, the patient should know everything and he will be sharing the decision about everything. I think Dr. Sarah, yeah, I remember now, she's told you, Dr. Omar, that
Yeah.
there is, it's early to answer this question.
Yeah,
It's,
for
Yeah.
sure. I'm just trying
No,
yeah,
to remind Dr. Ali.
hi, Dr. Bassem.
yes,
Hi.
Dr. Alam.
Yeah, no, that answer was to the question if there is any hope or there is
Mhm.
management or to this condition. She told him that it's early to answer this
Yes,
question.
yes.
Yeah, but Dr. Sarah was keeping to confirming that the patient that his mother has the right to know about her condition. Actually, she did very good and she knows how to reply to the question. But the problem that I felt, I don't know if everyone felt it, I felt like there is some disconnection between her and the surrogate. Like when he is like expressing concern or telling about something, she was also confirming about the information that she has the right to know about her condition. I think she needed to be more empathetic, more to be connected with the surrogate, like when he expressed about his father and what he went through. At that time, directly, she should give empathy and also to tell at that time that not all cases are the same. She told it, but later, yeah, she told it after he mentioned it again later. That's why I had a feeling that there is some sort of disconnection or
It's it's
yeah.
it's not obvious
And
that much, but she
yeah,
did
yeah,
perfect. Yeah.
I know. Yeah, she did perfect. Yeah,
Uh,
and the tune was, yeah. She needed to be more empathetic actually
Dr.
with him.
Yeah.
The answer for this, sorry, Dr. Omar, the
No,
answer for this question, actually, Dr. Omar mentioned already that it will be the benefit of telling her that it will help us also in the management of her, and maybe as we don't know yet if this a cancer or no, it's in the early stage, there is treatment or no treatment, so we can give her the proper care. Otherwise, she did well and she covered everything.
one golden advice. Dr. Basim, you wanted to say something? I'm sorry.
No, no, no. Go ahead. Then we'll start the other scenario. Continue.
For Dr. Sarah, given that there is short time for our exam, sorry. With regards to Dr. Ala comment, have you worked with any Filipino nurses before? Or I'm using the Filipino nurses because they do have very good communication, empathetic technique.
Yes, I
You
work
can,
with them.
yeah, you can imitate them. Imagine if you are telling them that you had a bad day. What would be their reaction?
They will hug me.
Like no, no, not that extreme, but they will use a tone of voice that even though with us as a men we might not want to use this tone of voice, but
Yeah,
this is the
I
tone of
know.
voice you need to be, oh, I'm really sorry, that like you know what I mean. So this
Yes.
is this is I try to do it myself, to be honest. There is few nationalities who are communicative by nature. This is his in his
Mm.
second nature. They will, even though if you are telling them a cheerful thing, he will be extremely happy. If you are told them something that is, even though if it's a little bit sad, he will engage with you in a very good tone of voice. You can use this tone of voice, um, even though your facial expression can reflect into that if you are not confident to use this tone of voice. Like,
Mm.
sorry, I'm sorry to hear that. Like this is they call it verbal and non-verbal cues, which is one of the communication things that they are looking to your face, looking where you are looking for, looking to if you are maintaining eye contact with the surrogate, appropriate voice, tone of voice, those kind of things would like use this to train in front of the mirror or something. Yeah, it would help you to give you the boost to achieve the full mark in the communication, and you are there. You're not far.
Yeah,
Mm.
thank you. Yeah, I believe on
Thank
this.
you,
Yeah,
Victor.
yeah, good advice. Thank you, Dr. Omar. I think Dr. Sarah can do it. Just some training, as Dr. Omar mentioned, in front of a mirror, or do like you are acting. Okay, I like before the exam, the day before the exam, to train on how to answer the examiner talking to yourself. Okay, you will go in a hotel, the area of your exam. You'll be in a room alone. Talk to yourself all the day how you are talking to the patient, how you are talking to the examiner, and use multiple tone levels to the surrogate different than to the examiner. When breaking bad news different than asking about counseling about the disease. So use your tone levels differently according to the level of the scenario or the task. Do it in the room the day before. I believe I did it all the day before the exam, and next day I was too much confident talking in a very fluent confident way because I just have trained last night. Do it, everyone. Dr. Omar, Dr. Sarah, anyone has a recent exam or coming exam, and believe me, this it will help you too much. Thank you, Dr. Omar. Dr. Ala, let's go to the next scenario. Dr. Omar, your scenario, you are the senior house officer in the neurology clinic. Mrs. Lily, 25 years old, overweight lady, presented to the clinic with a headache, lasted for 2 weeks with associated blurring of her vision. Examination showed that she had bilateral papilledema, idiopathic intracranial hypertension is the most likely diagnosis. The consultant, neurology, decided that lumbar puncture is recommended to assess and to examine the cerebrospinal fluid, CSF, and as a step to reduce the intracranial pressure. The task to discuss the diagnosis of papilledema, idiopathic intracranial hypertension, explain the procedure of lumbar puncture, address any concern that she has. Whenever you're ready, let's know.
Yeah, just 1 minute and then we will start.
Yeah, take your time. No problem. We can open the discussion. Anyone want to add any comment
Dr.
regarding
Basim?
previous or first scenario? Yes, Dr. Salma.
Yes. How I can ask from capacity? Uh, uh, what I will tell him is your mother have a capacity, or how
Yeah,
I can.
the easiest way, as I said, how is your mother now? And you can focus in the question regarding her awareness. Is she aware about your presence? Is she aware about your talk? Did she say anything about her decisions? All this will
Mm,
give you impression of the capacity. Or it will be written in the scenario that she is competent enough to take a decision. Okay, but if you want to confirm it as a capacity point of view, as I said, in this way. Okay, so the best way for any introduction, how are you? First of all, you introduce yourself, your department, or I'm a doctor, one of the doctors here. You are Mr. X, you are 35 years old. We are here to discuss about your condition. How are you today? How do you feel? Or how is your mother? How does she feel? How she is doing now? Then, what do you know about your condition? What do you know about her condition? Can you tell me in your words what she has? Whatever you want to use as a phrase, but do it in this way just to grasp some information, and you can judge on this information if she had the capacity, if she's losing the capacity, if she is sick, whatever the situation, you will know. Okay?
okay, thank you.
Okay. Sorry to keep you waiting.
Okay, here you go.
Hi, Mrs. Lily. I'm Omar. I'm one of the doctors in the neurology clinic today. Um, can I please
Hi,
confirm
doctor.
can I please confirm your age?
25.
Um, thanks for seeing you back in the clinic again. I do understand that you been visiting back because of the headaches and the vision, the symptoms with your vision that you are experiencing. Is that right?
Yes, doctor.
I'm here today to discuss with you what we are thinking as a reason behind this symptom.
Okay, doctor. So
Okay.
what's going on with me? Yes.
Yeah. So, how you are feeling at the moment?
Yeah, still I have headache, doctor.
You still have headache. Are you comfortable to talk at the moment, or you want us to give you any
Yes,
of the
we can talk
medication?
now. Mm.
Okay. So basically, this what we think that is going on, or the reason why you do have the headache and the vision, the blurring in your vision, is something that we call it idiopathic intracranial hypertension. Forget about the name. I'll explain it in much details now. So it is basically that our brain does have floats within a fluid around it, and sometimes the fluid might be produced in an excessive way or a little bit more than usual, or it's not draining very well. This is would put a pressure inside our skull, and this would manifest itself through headache and would push on the back of the eye. This would cause you the blurring of vision.
Okay, doctor, it's a serious
Okay.
condition. It sounds that I will lose my vision.
To be honest, it is not very uncommon condition. It is common in especially in young ladies, and it is treatable and manageable. If it is not treated, then it would affect the vision.
Okay, doctor. So how can I treat it?
This is a very good question. So treatment of such a condition would be through multimodal approach. It would be through many teams, but importantly, from neurology perspective, is that we need to relieve the pressure around the brain a little bit. Do you have an idea how we can do that?
No.
No. Okay. So in order to we will usually take the fluid, some of the fluid away through a needle that it will be done through your back. We call it a lumbar puncture. This is the type of the procedure.
Mm-hmm.
It is one of the treatment, but this is what the consultant is thinking is the best for you at the moment. So we are taking we are taking the some of the fluid away to decrease the pressure a bit. I will walk you through what's happening in this procedure. So we will numb the area usually around the back of your spine, where we are going to introduce this needle. It might sound scary, but it is not, it shouldn't be painful. Have you had this procedure before?
No, this is first time.
Yeah. So it is basically we will numb the area where we are going to go in, and we will take some of the fluid. It would give you immediate symptomatic relief in terms of the headache. We will give you after we will ask you to lie down in your back afterward, and we will give you some painkillers. You will lie down for a few hours, couple of hours. There is there any particular question about the procedure you would like to ask me from what I just explained?
No, but it's like not safe, doctor. There is any complication?
There is some complications as any procedure, but I want to reassure you that it is less common to happen nowadays because of the precautions we take, which is just we use aseptic technique. This is by that I mean is that to minimize any risk of infection. We will use a type of needle that doesn't cause trauma to where it is going or not, doesn't cause bleeding. We call it a traumatic needle. And one of the common side effects after the taking some of the fluid is that you might experience some headache afterward, but this is manageable through painkillers. There is a minimal risk of having pain after the
Okay.
procedure and some injury to the nerve, but it's very minimal because this is will be done through an experienced hands.
Okay, doctor.
Okay.
Mm.
I would like to talk with you about some certain things that it is important in the management of your condition. So, how have you been tried to lose some weight, or have you tried
Mm.
to go through this experience?
No, doctor. I'm busy all the time, so I cannot cook. I cannot do exercise. So I eat from outside most of the time.
Mm-hmm. I'm really sorry that yeah, it is it's especially if you do have a busy job, it's unavoidable. But we can have some solutions for that. We can refer you to a dietitian, one of the teams that will be taking care after you. And it's also showed a great benefit when you lose some weight. It would help in controlling the pressure around the brain. There is some
Okay.
sort of yeah. So do you want me to refer you to the you are happy
Uh,
for the dietitian to
yes, I will
meet
try
with
my
you?
best.
Yeah, this is good. And there is some sort of other medications it will be discussed with you after we see how the improvement from the taking some of the fluids around you from around your brain to help regulate the pressure. One thing that I would like to touch with you is that do you drive?
Yes.
And do you still drive?
No, this no,
2 minutes
because
left.
Okay,
yeah,
good. You I do it you should continue not to drive till we establish a good control. I know this might sound a little bit devastating, but this is what it is advised until we establish good control and all of the visual symptoms are controlled, then um, we can reassess you for fitness to drive again. Is that okay?
yes, doctor.
Do you smoke?
Yes.
Have you tried to quit smoking?
No.
We do have an amazing smoking cessation team, and it is beneficial that few. It would be a great help if you stop smoking, to be honest. They will walk you through the journey. They will show you support around this.
I will think about it.
Okay, great. Great. Do you have any plans to start family?
No, I'm using
Okay.
this control pill.
Okay. I think this is one of the things that we need to change. So we will refer you to the fertility team or we will write to your GP to choose a different method because it's one of the risk factors for you to have it.
Okay.
Is that okay?
Yes.
But if there is any plans, please involve us if you wish to start family. Okay?
Okay, doctor. Thank you.
Thank you. I think time's up, Dr. Basim.
Yes, Thanos.
Hello?
Yes.
Yes, time is up.
Yeah.
Yes, thank you, Dr. Ahmad. Dr. Sarah, you can comment now, please.
Yeah. First, there is one sentence that I think all the doctor told us don't say the name of the diagnosis, then to say the patient forget about the name because it's no one will forget about his disease. So this sentence they not prefer to say. Another one, you explain the disease well, but you forget, I think, to mention what's the cause of this, what's the possible causes of this disease. It's idiopathic, most common is idiopathic, maybe because of the weight, medication that you take, like vitamin A, OCPs, and yeah, I said vitamin. Also, you forget the consent for lumbar
Consent.
puncture. Yeah, to mention consent that after if she agreed to this, she will sign consent.
if she agreed, this means that she does have consent. But if you think that we should mention the consent, yes, this is very good. Yeah.
Yeah. Yeah, I'm not sure, but I think we need to mention that she will sign consent,
Yeah, yeah,
Yes,
yeah,
yes, of
and
yeah,
course.
if
yeah.
everything that she will, everything you mentioned, that will be mentioned in this consent.
Mhm.
And only this my comments for this case.
So the clinical communication, you want minus for the consent?
Yes, the consent and for the causes for this condition.
You know, I want also to point to something he did when he
Mm,
asked about the driving, and you start to talk. I'm not driving. He stopped you. He
yeah,
interrupted you,
yes,
which is yeah, it's just irritating to the examiners. Believe me, some examiners they might give you unsatisfactory for this. Let her finish her talk, whatever she is saying. Okay, this
yeah.
is
I
the
think
first. Mm.
also in the يعني I think that he need to also ask me before he start to explain about the disease. To ask me if I heard about this condition before or he want me to
Yes.
explain.
Yes, I agree also too. I will add this comment also because you didn't communicate during the explanation till she said, okay, doctor, you have to be communicating as a conversation, not as one way conversation. So it's two way or two person. So you are giving the information and you are asking if she can hear, she can understand, she is following. Okay. And I believe one of the important method to teach or to instruct or to explain here is the drawing. So you can tell her, I can draw for you. The brain is floating in a fluid. This fluid is in excess amount in your condition, and no reason till now for it. But what one of the reason is the weight, overweight. So I like the way when you ask about the dietitian and the opinion. We refer to the dietitian, which is good as a clinical judgment. So it's one of the ways to manage this the weight reduction. So it's good to include the dietitian, but don't be talking alone. You have to ask her if she can follow with you, if she can understand, she absorb. Does she need anything to ask about? Because what I felt like you want to tell her, but without asking or waiting for her opinion or waiting for her understanding. Okay, so this is will be again in the clinical communication. So again, I want to give you the lowest mark to be more motivated, not to be depressed. Okay,
Yeah,
so
yeah. I'm not depressed. No, don't worry. Don't worry.
okay, so it's so
Yeah, no.
unsatisfactory for the interruption. Take care of this one. Believe me, interruption of the surrogate, it failed me in my first attempt for 1 mark. When I read the comment, they wrote that I interrupted the surrogate. And what I was interrupting, I was saying, I can appreciate your worry, I appreciate your feeling, I appreciate your concern. And she's shouting because she is worried about her father, and I'm trying to calm her down. Imagine I'm not interrupting for her words. She's just shouting because she's worried, and I'm trying to calm her down. I'm not giving information. I'm just calming her down. However, they minus me, and the mark I minus in this skill, it failed me in the all exam. Okay, so take care. It's very irritated point. Whenever the surrogate is talking, be silent. Okay, let her finish whatever she want to say, then continue talking. Otherwise, as a clinical communication, you cover all the task regarding the smoking, alcohol, the weight, the job, the driving. Did you ask about the job?
No, I didn't.
Mm.
But
I
it will
told him
be.
that I
I
am busy
felt.
in job.
Yeah, what I felt is that in such a case, the main task I felt I need to fulfill the main task, which is to explain the diagnosis, to explain the idiopathic, the procedure, and the potential complications for the procedure, and then the risk to manage the risk factors that she does have, overweight, the birth plan, the smoking, the driving. Uh, but for the job, it is one of the
Yes, yes.
one of the things that. But I've tried to imply that she will be managed through um multiple team in case if I didn't have time to cover everything.
It's
I
okay.
felt.
Yeah, it's okay. Just to put it in your mind. Next point for the concern. She asked you clear concern. Doctor, is it serious condition? And what your answer was? You told
It is
her,
very it's very
yes.
common in the age in her age group, and it is treatable and manageable. If it's left untreated, this is was my words. It will have consequence on her eye. Or I did mention that when she asked me, "Will I be losing my vision?" So my reply was, "If it's left untreated, then it will have an impact on your eye." So
Yeah.
this was my
So
answer. So tell me, like what you.
is it serious? You didn't say is it or not. This is my point. You didn't give her a clear answer regarding is it serious? You answer
Okay.
it in direct way. Yes, if not treated, it can have harm on your vision. But is it
What
serious?
do you what do you think it should be framed?
Maybe maybe it's serious from other uh, aspect from the neuro, yeah, right? So it's not only the vision, so it can lead to also to cranial nerve compression, right? It's not only papilledema.
Yeah. So it
Okay.
is serious,
Yes, this is what I
like to
want you to
answer.
say. It is serious whenever it's not treated well or not controlled.
Hmm.
Okay. The other thing you said, perspective or neurological perspective. Do you think the
Hmm.
patient will understand what is the neurological perspective?
Perspective, yes, it is.
Yeah, of
Perspective. They
course.
here they
No,
understand what
I'm talking
perspective means.
about, yeah,
Neurological. Here it's a
yes,
common term, but I think in overseas center you will use from brain doctor's perspective, or from
yeah.
our clinic perspective, or from our clinic view. But here it's not considered a jargon, because the
Okay.
patient is been sent an appointment to a neurology clinic, so he knows what term neurology means. It's not her first visit, so the neurology is not it's not her first contact with the clinic, because she's coming back to the clinic from the scenario. This is what I understand. So this is why I didn't feel myself in a position to explain what like to be using it in a very um,
Yeah,
uh,
okay. We might give you the excuse that you are in UK, but I usually say it as advice, be simple as much as you can. Use simple terms, use simple words. Don't be complicating in the explanation, because they are saying and they are commenting that you are using or talking as jargon. By the way, a lot of comments as feedback about jargon.
mhm.
Okay, yeah, maybe in overseas more than the UK, of course, but they are still commenting on this. So try to be, as I said, simple as much as you can in your words. Okay.
Yeah.
Otherwise, yeah.
No, no,
Okay.
no. Please continue. No, no,
Yeah,
please
yeah.
continue.
The drawing of lumbar puncture, the consent.
Yeah, to be
Yeah.
honest, I will be drawing, but I can't draw in this session. So I use this method, even though in the daily practice I like to draw things easier to avoid you to say a lot of things. So in the exam you will have the ability to draw, but
Yeah, but what you are training or used to do, you will do it in the exam. And believe me, with the stress, you will forget. And after you will get out from the station, you will be shocked. Oh my God, I didn't draw. This is what I realize on the practice and the exam experience from other candidates. Anyway, it's good. You know how
to be honest, when I was talking, I was drawing.
okay.
When I was
By the way,
talking in the station, I
you
was
can
drawing.
draw in the screen. There is way. There is a pen on the screen. You can use it.
Yeah, yeah. I don't know how to use it, to be honest here, but I was drawing on the paper, like when I
It's
was
okay.
trying
Yeah.
to.
All right.
Yeah.
It's okay. So this is the marks. Again, the complication is not only papilledema. Be careful. Okay. It's papilledema, and also there is ophthalmoplegia, right?
Yes,
So there is sixth nerve palsy. It can
palsy.
be, yeah, so it can be there. So try to mention or to have some complication or to add some complication to your counseling about this disease or intracranial hypertension. Dr. Ala also add here some causes. So first of all, from the name, it's called idiopathic, so no reason. However, some triggers like the obesity medication, like steroid, vitamin A, tetracycline, some antibiotics. So you can put it as triggers. However, it's called idiopathic. So the main reason is no reason. It's just unknown. No one knows. However, the explanation was perfect. The fluid excess and the floating and the way to remove the complication. I like when said there is possibility to have a headache, but the best way is to lie again in the bed for certain hours. It's the best way to avoid this headache, along with some painkillers. I also the introduction was perfect when you ask, "Do you feel any headache now?" And you want me to give you any painkiller. How do you feel now? Really, it's good as total. Some kind exam they can give you good mark, but I just said to minus and to make it at the lowest level, just to motivate both of you, Dr. Sarah and Dr. Omar, because your exam is 2 days or maybe less apart. So be ready, be more confident, take it as a positive and energetic one to overcome this one, and hopefully you will pass the exam. Any comment, Dr. Omar or Dr. Sarah?
Thank you, Dr. Bassem, to let us practice.
Yeah.
Thank you, Dr. Bassam, for
Yes.
accommodating our comment and everything, to be
No,
honest.
it's okay. It's my pleasure.
Yeah.
Please give a chance to the surrogate always to reflect or to react. Don't be one way talking.
Yeah. What I was doing, I was giving pauses. I don't know if you noticed that or not, but one of the things
Mhm.
that you stopped talking, I stopped talking for almost 10 seconds to give Dr. Sarah a chance, but I don't know, and she wasn't replying, so I continued.
Yeah. Okay.
But
Maybe.
you are right.
Yeah. Give
We
a
can just
question.
give
Exactly. Yeah. Give a phrase like, "Does that sound good for you? How that sound for you?" These phrases are helpful, and it gives the examiner that you are trying to pay attention to the surrogate, not only talking. Okay.
Mhm.
Yeah. Okay. Any question from others or comments? Dr. Ala, anyone want to add a comment? Someone wrote موفقين إن شاء الله. Yes. I think
Uh,
I believe on both of you. You will do it this time. Your experience and your performance is really amazing. It can give you the pass mark. Yes.
Uh,
Yes.
Dr. Bassam, do you think did I miss anything critical in this station, like in this diagnosis, or did I cover everything
No.
apart from the comments?
I usually say whatever the disease counseling, you have to say.
Mm-hmm.
First of all, of course, try to ask, did you hear about this condition before? Because believe me, some of the candidate, some of the surrogate, they will search nowadays. The AI help a lot. Some patients they give the symptoms to the AI, chat GPT or whatever, and they give them some examples of the possibility what they have. So ask this
Mm-hmm.
question: do you have any idea about this condition, or did you have any idea, or do you hear about this condition before? No, doctor. You want me to explain? Yes, doctor. Of course. No, this is the condition one, two, three. So I believe whenever you are counseling about disease, what are the causes, and the manifestation, and the complication, and how to investigate, if not investigated, how to manage if there is cure or management plan.
Mm-hmm.
Yeah, this is what I think you cover all of them except the complication. Papilledema you mentioned, but it's not only papilledema, and you address the driving. No fatal mistake. What I want to say, the only fatal here, the interruption. Imagine you will do everything good. Once you interrupt the surrogate for one time, oh my God, the examiner might look to each other it's like fatal mistake, and they might, unfortunately, they can forget everything you did. So it's very fatal to interrupt the surrogate in any station. Let her or let him finish what he want to say. It's, if something not related, you can tell him, okay, we will come to this part later on. If you want just to overlook this part, because some of the surrogates, believe me, they have the access to say everything without not related to the question. So you are asking, what about the past medical history? He will tell you, doctor, I had a surgery which is done before 10 years ago. Okay, respect what he said. Okay, we will come to this part a while, after a while. Okay, why? Because you have approach. If you follow your approach, you will cover everything. But if you follow his approach, he try to pay attention to this part to distract you from the approach. Whenever you went with this, believe me, you will forget your approach. You will miss something you already planned to do. You got my point.
Hmm.
Okay. So again, the cornerstone of the counseling, as I said, causes or the pathology, pathophysiology, manifestation, and the complication, investigation, and management plan. Any other
Okay.
comments or question, Dr.
No,
Omar?
no, no, no.
Don't forget to use the multidisciplinary group of doctors or group of teams. You mentioned it. So there
Hmm.
is a team you will be followed with, including the brain doctor, the doctor or the nurses, specialized nurse, the eye doctor, definitely will be involved for the papilledema. Sometimes they do optic nerve sheath fenestration. You know this technique.
Yeah.
Whenever there is papilledema, and maybe they give local eye drop or topical eye drop. So use the word
To
of
be honest,
multi.
I was awaiting if there is any concern regarding this, so I will be offering alternative, which is shunt or the fenestration.
Exactly.
But there was no concern, so I I said that we will monitor your response to the lumbar puncture first. If there is good
Perfect.
response, then we still do have few options. So
Yeah, perfect. So it's depend on the concern from the patient. He might tell
Mhm.
you what else is there in other option. But I like the dietitian reduction of the weight, and also you can add don't use any medication without medical advice or your
uh,
GP.
yes, because of the topiramate or the medication that she will be on, she need to have a planned pregnancy. In this case, in general, this patient would be started on topiramate and acetazolamide. So topiramate is teratogenic, but it's very beneficial in terms of controlling the weight and in controlling the pressure inside the brain.
Yeah,
So this is why I wanted to ask about the pregnancy to tackle both point, the risk factor
perfect.
and
Perfect.
and
You know, if you do this, you will get the full mark because it's
in
advanced step of the management. So whenever you are planned for pregnancy, let us know to be
yeah.
planned one. Why? Because pregnancy can be trigger. Plus, some medication, if you use, it can also be a trigger on this disease, or it can harm your baby. So, to be safe from all side aspects, please let's have a planned pregnancy, which is
Yeah. So usually who changes the the contraception method? Because I didn't look into it. It was just like me improvising in the station. Um, I do understand here it's the GB, but an overseas center, should it be the gynecology or should it be the fertility doctors or um,
gynecology. They are the one concerned
okay.
and following the patient. Fertility for those who have difficulty to conceive.
Yeah. Because I don't know in overseas what exactly you should phrase if you are addressing this point.
For me,
for the
I would say
benefit of
pregnancy
everyone.
doctor. Pregnancy, not gynae, not fertility. The pregnancy doctor or the woman doctor.
Yeah.
Okay, the
Okay.
most easier and simple, the woman doctor to plan in this way. Okay. Dr. Mahjoub, yes, he wish you the best, Dr. Tara and Dr. Omar.
دعواتك
Thank you.
دكتور محجوب.
Yes. Uh, 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 Hopefully you do it. Believe me, this time you have the confidence. But some comments, try to use it as I said. Follow the advices. Inshallah, it will help you. Dr. Tahani, treatment acetazolamide, topiramate, ventriculoperitoneal shunt, optic nerve sheath fenestration. Again, whenever you reach to this extent of information and details, you will impress the examiner. However, it's not necessary to mention them all. What you are talking or what's your plan to talk about the task. The task is to do lumbar puncture for the diagnosis and for relieve the pressure. If he asks what else, doctor, now you can talk about these advanced ways because you don't have yet the diagnosis. So it's still suspected. But put it in your mind that whenever you reach to this information as not as instructed from you, so you are not the one who will be volunteer to mention it. The surrogate will ask you and you will give this information because it's beyond the scope of PACES, but it's there. If they ask you what are the possible other management plan, doctor, so you can say these steps. Okay. By the way, IIH, idiopathic intracranial hypertension, comes in the long clinical consultation as a scenario, and the management plan, the investigation, everything will be discussed in this way, as Dr. Tahani mentioned. So be ready. You might have this case as long, you might have it as a communication. Okay. Any other question or comment?
No, thank you, Dr. Bassem. Thank you, Dr. Sarah. Thank you, Dr. Alaa.
Okay.
Thank you, Dr.
So
Mahjoub.
I wish to be the last communication practice in my session. However, you are welcome, anyone welcome to visit my session to give advice, to instruct, to give a feedback, to help others. But I don't want the participant to participate again as a volunteer for the practice. Anyway, again, wish you the best to pass this exam and hopefully you'll do it, both of you. And thank you, Dr. Ala. All the best for all of you, inshallah. Thank you again, Dr. Sarah, Dr. Ala, Dr. Mahjoub, everyone attend today with me. See you tomorrow, inshallah, with a short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Waalaikumsalam.